Healthcare workers who work in nearby hospitals are now being advised by their employers to take precautions getting to and from work this weekend. The situation also has some physicians worried that their patients could get caught up in the mix.
They're coming from very far away, and their cars don't say, I'm a cancer patient. They're just going to be caught up in the traffic, and that 70-year-old patient with metastatic cancer is going to be walking in the snow trying to get to their hospital. And this is the situation you want to avoid. The content is immaterial. People can protest Hawaiian pizza or whether the world is flat or they disagree with federal policy. That's their choice. That's their right in our democratic society. The real issue is there cannot be a block of access and there cannot be intimidation of healthcare workers.
Another physician, Dr. Michael Warner, recording a statement urging protesters to consider how close they'll be to hospitals.
Before you lean on your horn and before you yell and scream, I'm going to think about those patients, those people who could be you or someone in your family.
The hospitals are also preparing. In a statement, Mount Sinai leadership saying scheduled diagnostic imaging and surgeries are continuing as planned, but patients should be prepared for delays when traveling to the hospital. And the Ontario Nurses Association saying in part, ONA unequivocally condemns any protest activity that prevents nurses and healthcare professionals from doing their jobs.
We are not against the hospitals. We're not against healthcare workers. We want to see change, though.
Krista Nagel is a nurse who's been participating in the Ottawa demonstration. She made headlines early last year after London Health Sciences Centre fired Nagel with cause after an investigation for organizing a lockdown protest and attending another in the U.S. Last fall, Toronto hospitals had protesters on their front lawns, rallying against vaccine mandates. Healthcare staff were able to keep working while people gathered outside. Nagel says tomorrow's focus is political, not medical.
Very confident. It has nothing to do with the hospitals. There's no direction that anybody wants to take on the hospitals, has nothing to do with that.
But is the demonstration prepared to remove those who've come with bad intentions?
That message has been spread out loud and clear to everyone that is here. We want this peaceful. We want this respectful.
Is the honking 24 hours?
No, absolutely not.
In response to those hospital protests I told you about just a couple of seconds back in December, Parliament passed a bill that makes it a criminal offense to harass or intimidate healthcare workers or patients seeking care.